Good morning, everybody. I'll be presenting the presentation titled Diabetic Retinopathy, Lack of Awareness of Risk Factors, Contribution to Disease Prevalence in Urban Slums. So coming to some of the facts of the Indian and its slums, India is home to 66.8 million diabetics. The blindness due to diabetic retinopathy is rising as a major public health concern in India. India also happens to be home to 158 million population which lives in slums. So this study is based in Mumbai, which is the financial capital of India, and has 42% of its population living in the slums. So the research question that was posed in this study were to estimate the prevalence of diabetic retinopathy in urban slums, to evaluate their risk factors, and to understand the awareness for these diseases in the population. So the methodology that was opted was a population-based study that was conducted in the urban slums of 7 wards of Mumbai in the period of January 2012 to August 2014, wherein 6,562 subjects were screened for type 2 diabetes mellitus through epidemiological surveys, which involved door-to-door survey, through screening camp where a mobile van was stationed into the slum itself. The van had an inbuilt camera, fundus camera, which was used for fundus photography and diabetic retinopathy screening. And appropriate referrals were made. So coming on to the observations, so we enumerated a total of 6,562 eligible subjects above the age of 40 years in the urban slum population. So the total number of subjects with type 2 diabetes mellitus that finally participated in the study were 608, of which 514 were known diabetics and 95 were newly diagnosed diabetics. So the average duration of diabetes in the known diabetics in our studies was 6 years. Coming on to the details of the observation, the prevalence of diabetic retinopathy in the general population was around 2%. The prevalence of diabetic retinopathy in type 2 diabetes mellitus was 16.78%. So this means that 1 out of every 5 subjects with type 2 diabetes mellitus was found to have diabetic retinopathy, which is quite high a prevalence. The prevalence of diabetic retinopathy among known diabetics, that is already pre-existing, they were aware of their status, was 18.7%. The prevalence of DR among the newly diagnosed diabetics was 6.32%. That is, 1 out of every 15 newly diagnosed diabetic in the slum was found to have diabetic retinopathy, and they were not even aware that they were diabetic and had retinopathy also. So coming on to the regression analysis of diabetes and for its associated risk factors with DR as an independent variable, it revealed to us that 2 main associated risk factors which was significantly associated with the prevalence of diabetic retinopathy in this population were the duration of diabetes and the male gender. We looked into the impact assessment of our study following the awareness campaign. So we tried evaluating them before and after the awareness campaigns that was provided to the slum population by our community health workers. So surprisingly, when we asked them, like, were they even aware that diabetes affects the eye or that they need to go for an eye checkup once they've been diagnosed with diabetics? So more than half of the population was not aware that diabetes is a disease that can lead to blindness as a complication consequent to diabetic retinopathy. When we did a post-survey, we found that the awareness levels went as high as to 90% when the population was told what is diabetes, how it affects the eyes, and what are the ways to prevent blindness in a patient who is having diabetes and is susceptible to have retinopathy. So this points out that there needs to be an adequate educational and training of the slum population or the underprivileged population for diabetes and its blinding consequences. Just to wrap up, this is the study, the AJ drums, that is Aditya Joe Diabetic Retinopathy Urban Slum Studies, findings of which I have just narrated. It's a population-based study. It is the unique population so far because none of the studies across the globe have covered the urban slum population so far. So the proportion of diabetic retinopathy in the slum was 16.78%, which was as high as to the urban population. And just to conclude this, more than half of the study participants never heard of diabetes and they were not even aware that diabetes affects the eye and causes blindness. That's all. Thank you.